Now, healthcare workers across the country are getting their first dose of the coronavirus vaccine. One of those individuals is a member of our CBS News family. Here's video of Dr. Jon LaPook getting his vaccine earlier this morning. Our viewers might know him as CBS News' chief medical correspondent, but he's much more than just that. LaPook is a practicing physician at NYU Langone Hospital in New York City. The nature of his work there gives him priority access to the vaccine. And Dr. Jon LaPook joins me now. Sir, thank you so much for taking the time to chat with us.
Hi, how are you?
This must be such a big day for you. As someone who has been on the front lines tending to very sick patients, how do you feel? What's going through your mind as you're getting this vaccine? This day is such an important day for you.
You know, the vaccine itself was no big deal. It was a little pinch like a flu vaccine. But I was taken by surprise when I was talking to the CBS News cameras directly afterwards, that I got very emotional. I got teary. And I was trying to figure that out, but I guess it's just been the weight of this pandemic that so many of us feel. For me, I was on the COVID wards back at NYU Langone Health, where I'm a professor of medicine, back in April, and I saw the devastation, the death, and we really were throwing the kitchen sink at it. We didn't know really what to do. We felt so helpless, and I think a lot of that helplessness has continued over the summer and the fall as we see a map of the United States, and you see it just looks like it's on fire. And in addition to that, I guess if I'm trying to psychoanalyze myself, do armchair psychiatry, you know, there's the pressure of reporting on it as a journalist, but also the pressure of trying to keep myself, my family, my loved ones, everybody else, so many people calling me, trying to give them good advice. And now there's this miracle, this technological tour de force of a vaccine, more than one vaccine, two of them that are 95% effective, 95% appear to be safe. And that it's available in less than a year. I mean, that is just astounding. So a mixture of emotions, all good. And, you know, there have been some reports of some side effects, some allergic reactions. I feel great. It's a little more than an hour since I got the vaccine. We're going to have to look at this more carefully. I spoke to Tony Fauci, and he told me that they're convening a little group to study the allergic reactions that we're seeing and to find out what's the incidence and maybe what's the mechanism.
Yeah, there must be so much relief and hope wrapped up into this moment for you today. Obviously, as we kind of shift toward the general public eventually getting this vaccine, what are some of the biggest things someone should consider before getting the shot?
Well, I think, you know, there's huge vaccine hesitancy. Right now, in terms of the allergic reactions, people are being warned that if you're allergic to any component of the vaccine, to not take it. And that advice is going to be refined. You know, we're at the very beginning of this, so we're going to get some better advice about that. But in terms of the vaccine hesitancy that people feel, I understand that. You know, especially people of color, minority communities, they've gotten the short end of the stick with healthcare for so many years. And of course, there's the famous Tuskegee study where hundreds of black men who had syphilis were studied for decades and not treated to see what the natural history of the disease was. It's not just that, it's things that still exist right now in terms of healthcare inequity. So we in the healthcare community have to do a better job of explaining to people that it is safe and effective. And that means that not only people like me, but also people in the community, I think faith-based leaders and community leaders need to explain it. Here's the best explanation I can give you about why it is safer than people think. People hear the term Operation Warp Speed and they get scared. Oh my God, warp speed, it's going to blow apart. It was too fast. Well, actually, the vaccine, which was developed for Moderna in only 2 months, it's based on technology that went back 20 years. So in 2003, it took 20 months to develop the first vaccine for the first SARS virus. And then 3 years later, it took 11 months to do bird flu vaccine. And then 3 years later, it took 6 months. And then 3 months for Zika 4 years ago. And now this is 2 months. So it's not like somebody snapped their fingers and said, let's make a vaccine. It was a slow process built on something called vaccine platform technology. And very quickly, what that means from Dr. Francis, which you don't have to know any science for, is imagine you want a factory that's making a widget. And you've got it all set up, it's making great widgets. And now suddenly you want to make a new widget. You don't have to have a new factory, you don't have to have new employees. You have to sort of fiddle with the process on the assembly line. So you can much more quickly make a new widget, in this case a new vaccine, much more quickly. And so people shouldn't feel that it wasn't done with care. What was done differently than in previous years is the red tape was cut in terms of the testing, and that's Operation Warp Speed helped with that. So red tape was cut, no corners were cut in terms of safety as far as I'm told, and of course hundreds of millions of doses of vaccine were created, bought at risk, meaning now that we know that we have at least 2 vaccines that are effective, we don't have to start making it now. They're already here. We can start giving it. And you can see behind me, this place is very busy at NYU Langone Health. The frontline workers like myself who have direct contact with patients. I do GI, so I do procedures where there's potential aerosolization of virus, which is increased risk to me. We're getting vaccine. It's a very smooth process, and I couldn't be more impressed with this institution. I am biased. I'm a professor of medicine here, but I think I can at least objectively report on that.
Yeah, when you walk us through the timeline there of the speed in which this vaccine came to fruition, it's pretty incredible. Now it's the PR that's equally important to get the public to go along with it. Now, I want to ask you about that new strand of COVID-19 in the UK. Doctor, can we say with certainty that this current vaccine would effectively stop it? And if not, when will we know?
Okay, so my go-to guy is Tony Fauci. I've got him on speed dial. So he's been explaining this to me. This strain, first of all, this type of virus, it mutates all the time. There are already like 4,000 mutations of the spike protein that everybody has been seeing in those pictures. So what this mutation seems to be doing, possibly, maybe probably, is increasing the infectiousness of the virus. However, it doesn't seem to be making people sicker, and very importantly, it doesn't seem to be affecting how effective the vaccine would be. And the reason is this: when these mutations happen, it's a point mutation, one area, for example, at a time, one amino acid. And so it might, if you're unlucky and had a monoclonal antibody, only one antibody, it might make it tough for that antibody to inactivate the virus. But when you have a vaccine, you have hundreds of different antibodies that are created. It's called polyclonal, not monoclonal. So even if that one spot causes a problem with one antibody, you've got so many others. So at least theoretically, we don't think that this is going to affect the effectiveness of the vaccine.
A glimmer of hope in a very long, dark tunnel. Dr. Jon LaPook, thank you so much.